Good evening. At the outset, let me welcome you all once again to this first midterm conference. I would be speaking on a topic which is not so uncommon, particularly for the beginner. So it is very important to recognize this problem and handle this. So why the phakic IOL is so popular nowadays? Because of its ability to take care of the high range of refractive error, particularly myopia, and being reversible procedure which offers very high quality of vision, and there is potential gain in visual acuity also. And this correction can be, this procedure can be adopted for those patients where the corneal thickness is not allowing to go for the LASIK procedure, and there are less chances of dry eye. So let us come with the real case scenario. A 21 years high myope lady underwent this phakic IOL implantation for myopia of minus 8.5 diopter in the right eye, and next day the visual acuity was 624. That was quite unexpected, and there was slightly low halt, but I asked the patient to come after 3 days, but she reported after a week. And when she came, the vision was actually 624 parts, and there was pigments on the phakic IOLs, and there was extremely low halt in center. And when I dilated the eye, I could see that the posterior or the convex part of the actually IPCL was touching the anterior capsule of the lens. And there was some specks of anterior subcapsular opacity also. So this is the street lamp picture of the patients showing pigments. Halt is very quite low, and the anterior segment OCT actually clears the diagnosis that it was reverse implantations of the phakic IOL. So there was no option but to take out this lens. And whenever we get such cases, we have to immediately take the patient to take out the lens, otherwise it can cause cataract, and this cataract can progress in no time. And removing the lens is again very much actually a delicate procedure. One has to take care of the endothelium of the cornea and the lens as well, and just nudging out the haptic, and then it can simply be pulled out. And after the second procedure, the halt increased to the satisfactory level, and patient improved. So what is the reverse implantation? Actually, this is one of the rare intraoperative complications of the phakic IOL implantation due to most of the time due to incorrect loading technique, or due to intraoperative flipping or failure to recognize the incorrect side opening into the anterior chamber. So everyone has to follow certain rules and has to be very careful while loading the lenses. There are some marks on the lenses, like the prototype ICL lenses. There is a hole in the leading right side, and in the IPCL there is a bump on the left side with 2 holes which actually be placed in the superior part. So the implantation technique should be, for that one has to carefully pay attention on the loading of the ICL and IPCL, so that you do not land up in the problem. So while loading, you always look at the leading haptics should be on the right in the ICL, and when in the IPCL, you have to see that the bump is on the left side. And once you do that, there are less chances that there will be incorrect unfolding of the lens, but sometimes it can flip. So at that time also one has to be very much vigilant. So this was a case of IPCL which actually unfolded in a wrong direction, upside down. There was no problem with the loading, nothing, but somehow the lens was opening in the improper direction. It was holding up, folding in the upside down position. So just see here, the bump is on the right side. It should have been in the left. So at this point of time, I thought to remove, but I thought to give chance, I injected the high quality viscoelastic below the lens and above the lens, and tried to roll it like a paper. And I with no surprise, the lens actually could be re-inverted back into the proper direction without damaging the anterior capsule and the endothelium or cornea of the patient. So this can be attempted, but this is risky also. One has to be very much I think that very much expert in doing that, or would say that rather you don't take chance. So this lens was again re-inverted back. So why to recognize inverted phakic IOL? Because of the complications of progression of cataract, secondary angle closure glaucoma, and recurrent iritis. So how to recognize? Once you see that the halt is very low, less than 250 micron, then you must suspect it. Whenever you have a doubt, dilate the pupil and see whether the lens is in the proper way or not. Or anterior segment OCT can clinch the diagnosis. So what to do? There is nothing, no option except to remove this lens and implant with other lens. So just to summarize, reverse phakic IOL implantation is an inadvertent and rare intraoperative complication, particularly for those surgeons who are venturing into these phakic IOL implantations. And one should be very much careful while loading and while injecting the lenses, so that you don't end up in the problem. And always suspect when you find a low vault post-operatively. And anterior segment OCT can be very useful to clinch or to confirm this diagnosis. And it should always be explanted once you get this. So thank you so much.